Let me ask you, as we approach this anniversary, how happy you are, how pleased you are with how far we've come since then. What remains undone, or what would you like to see your successor focus on when it comes to recovery in particular?
We're really pleased with where the recovery is. 5 years later, we've outpaced New York. We outpaced the Louisiana, Mississippi post-Katrina. We still have about 1,400 families that are not back in homes. We started with 365,000 homes destroyed or damaged. So, until those families are home, I'm not going to be satisfied. And secondly, there's still resiliency projects that are being done that are not yet finished. We almost have the entire coast done with dunes to protect those coastal homes and neighborhoods. We're doing resiliency projects for our energy infrastructure because we had 2.8 million households lose power at Sandy. We can't have that happen again. We had all our gasoline refineries, all of our infrastructure was just destroyed. It's been rebuilt now and made stronger. And so I'm pleased with the way that's going. I think the next administration is going to have to make sure those things get finished.
What has this experience taught you about the role the federal government should play in a disaster like this and generally? Did it change or did it reshape your sense of what the federal government should do?
No, but it reinforced it. In a natural disaster as severe as Sandy, the federal government has to take the leading role in providing the funding to get this done. No state can absorb this on their own. And so they have to play a leading role in funding, which means they're going to be involved in how that money is spent as well. But that should be done in coordination with the state government, who knows their state best and what the needs are. But the role of the federal government, first and foremost, is to protect the health, the safety, and welfare of their citizens. And nothing personifies that other than war than responding to a natural disaster.
You see the desperation in Puerto Rico, you see it in Texas, Louisiana as well. And I wonder how you react to that as you look at people who are fearful that the federal government is going to forget them and what they're doing. What's your message to them? What are you watching for in terms of a federal response to the storms that we've seen over these recent months?
Well, first of all, there has to be a huge volume of federal response, and I think there has been. Secondly, the state government has to understand that ultimately this is going to be their responsibility to fix. So whether it's the territorial government in Puerto Rico, it's going to be, or the state government in Texas, they have to be the ones who are going to get their arms around the needs of their people. But when I look at the people, what I want to grab them and say is, it's going to be okay. It's going to take more time than you're going to want it to take, but it's going to be okay. And it has been in New Jersey and New York, and it will be, I'm confident, in Puerto Rico and in Texas.
You've been in that position as a governor on the ground when President of the United States comes to survey what's happened. What was going through your head at that time, and what's the most positive role a president can play going to a place like Puerto Rico or New Jersey after Superstorm Sandy?
Well, first off, to let the people know they haven't been forgotten. That's really important, and you said that in one of your earlier questions. People fear they're going to be forgotten. Now, in the context of Sandy, remember, it was 8 days before a presidential election that the storm hit, and 6 days before a presidential election when President Obama came. So the politics were kind of tense at that time in the country. But the president rose above it. He didn't insert politics into it, neither did I, and it shouldn't have politics inserted into it. There are things that need to be done, and the thing the president can do is twofold. One, when he sees it himself, he can go back to Washington with a clear vision of what the damage is, how severe it is, and so when people try to get him to go on the cheap, he's going to be less likely to do it. Secondly, it's an enormous lift to the people who live there to know that their commander-in-chief, their president, cares enough about them to come on the ground and see them and touch them and let them know that he's not going to forget them.
I want to ask you about the economy you're going to leave behind, the economy of New Jersey. New York was one of many cities, more than 200, that put in bids to have the new Amazon headquarters. What does that enthusiasm, as you've witnessed it, all of those cities trying to get in on that competition, say to you about the labor market today?
Well, what it says is that everybody's desperate for jobs, even though I think the economy is much better today than it was in New Jersey. When I became governor, our unemployment was 9.8%. Today, it's 4.5%. So we've cut it in more than half. There are more New Jerseyans working today than at any time in the state's history. And we're now third in the country in per capita income. So things are going well in New Jersey, and we've recovered from the recession and really are growing again. But a project like Amazon with 50,000 jobs that average $100,000 a year salary, those are really economy changers in a particular city. And I think that's why you're seeing so much enthusiasm. It's not just the number of jobs, it's the quality of the job, which has always been a struggle in this economy to get people making more money and a livable wage in wherever they are, and that's been all across the country. So I think that's why you're seeing so much enthusiasm about Amazon, but everybody should remain calm because it's coming to Newark.
How frustrated are you on the pension issue? Still a huge issue in New Jersey,
Hugely.
Something you've come up against time and time again. As you're leaving office, do you have a prescription for how to remedy that? If not fix it, remedy it going forward?
Sure. Listen, the prescription is there. It's just that there's no political will to get it done. And I'll be partisan now in this part of it, in the Democratic Party, who is, captive to the public sector labor unions. The fact is that I've put, think about this now, $8.8 billion into the pension system in the last 8 years. That is double the amount that the last 5 governors in New Jersey put in combined. We got rid of cost of living adjustments to help save $120 billion over the next 30 years. We've done a lot of things to try to help it, but you can't keep up. It's because the pension systems are too rich, and the thing people forget about is health benefits as well. I mean, the health benefits in New Jersey that are given to public sector workers are Platinum Plus as defined by Obamacare. If we just took it to the gold level that Obamacare says should be the top plan, we'd save $4 billion a year. We could take that $4 billion, put it into the pension system, and our pension system annually with another $4 billion a year would be fine within 20 years. So their prescriptions are there to get it done. We have to lower benefits. People need to understand that. And by the way, I suspect you don't have a pension. I don't have a pension. Even after serving as governor, I don't have a pension. I have a 401k program. That's the way that we have to eventually get to in this country. But the public sector unions have a stranglehold on some of this, and we simply won't let it happen, even though it's bankrupting our country.
Let me use 401k as a segue here to ask you about tax reform. Obviously, that part of the tax code's come into focus. State and local tax deductions, a huge issue to many of your colleagues, political colleagues in New Jersey. What's your message to Washington on the potential dissolution of that part of the tax code?
If you're going to do that, then you have to lower the rates enough to make sure that a high-income state like New Jersey gets the benefit. So that's net-net a wash to us. I advocated against the state and local tax deduction when I ran for president, even as governor of New Jersey, because I don't think the federal government should be subsidizing the huge growth of government at the state and local level. But what has to happen in return is the lowering of rates enough so that in really high-income states where there's a high cost of living, like New Jersey and New York, California, others, that the lowering of rates basically washes out the loss of that deduction. Remembering that 2/3 of the people in my state don't even itemize, right? So they're not even getting the benefit of that state and local deduction in their federal returns because they don't itemize. Only the folks who itemize do it. So it can be done the right way, but you got to lower those rates enough to make it a relative wash.
On the campaign trail, you were the most outspoken candidate about addiction and opioid abuse. You've chaired the President's Commission on it. He's scheduled to deliver a speech tomorrow. What do you want to hear from him? There's been a lot of frustration among many people that he hasn't declared it a national emergency. When's that going to happen? When are we going to get a drug czar in place? When is politicians writ large going to take this seriously as they need to?
Well, I hope soon. And I think the president will. I've spoken to the president about this for years. He understands this issue. He cares about it. And I think the actions you're going to see him take in the next few days are going to make it very clear how much he cares about this issue and what he's willing to devote to it. There are always going to be people who are going to argue about this, but addiction is a disease. It's a chronic disease, and we need to treat it that way. And we need to stop making the moral judgments of people. I hope that nobody starts trying drugs, but they do. And when they do, what are we going to do about it? Let them die? And 142 people are dying a day in this country from drug overdose. That means we have a 9/11 every 3.5 weeks in America. If we had a terrorist organization who was killing 142 Americans a day on our soil, how much would we be willing to spend to stop it? So I think that we have to speak about it in those terms, the pain and the suffering that it's causing our fellow citizens, and we need to step up aggressively to try to go after it. I believe the president is going to do that. I believe he understands this issue. I think that's why he asked me to chair this commission, because he knows my feelings about it. If he was looking for a minimalist, he wouldn't have picked me, right? So I'm very confident in the president. I believe he's going to do it, and I think tomorrow you're going to start to hear the real specifics on what a Trump administration is going to do to start to move this back. But what I need to caution people is this problem is going to get worse before it gets better, and it's going to take time for us to fix it.
One wonders what can be done at the federal level. There can be a national conversation about it, but as you look at how bad this problem is, what can the federal government do to curb it? Is this something that's going to be solved more at the local or the state level?
Well, I think it's both. For instance, do you know that, for doctors who write these prescriptions, they don't have to have any continuing education on opioids, their addictive process, or how to treat people who do it, but they keep getting the right prescriptions. The DEA can finish that. They can say, no more license to write these prescriptions unless you take certified continuing medical education to educate yourself about how you're killing people with this stuff. The United States consumes 85% of the world's opioids. We're 4% of the world's population. What are we doing? So I think the DEA can step in and be much more aggressive in terms of regulating what physicians are doing in writing these prescriptions. I think we can, through the National Institutes of Health, work with the pharma industry to come up with more non-opioid pain relief and to come up with more medication-assisted treatment for addiction. Those all things can be done at the federal level. Now, at the local level, you've got to be getting into the treatment issue. You've got to continue to work on education at the school level, and it needs to start in middle school now. Kids are getting addicted in middle school, in 6th, 7th, and 8th grade. If we don't start talking to them about it in 6th, 7th, 8th grade, if we wait to high school, many of them are already going to be lost. That stuff can be done on the local level.
Quickly here, what's next for you? There are a lot of vacancies in this administration, as we know. Could we see a drug czar, Chris Christie? Have you given thought to going into this government when you get out of office next year?
No, I won't be the drug czar. I've been in government now for 16 years. 8 years as the U.S. attorney, 8 years as the governor, and I've loved it. But I think that what is much more likely for me when I leave is to go into the private sector and start making some money. We were at the dinner with some friends, and they asked if I was going to go to Washington, and my wife interrupted and said, "We're hoping Chris reaches his financial potential." And so, I have 2 more children to put through school, college. 2 have gone through. I got 2 more to go. So I have some wood to chop. I suspect I'm going to spend some time in the private sector. I won't rule out going back to government, but I don't need another title. If I'm asked to do something where I think I can have a real impact, after being governor, that's what you're going to want, then I'd consider doing it. But I'm not looking for another title.